Welcome to Speaking of Science. The National Institute of Mental Health presents a series of conversations with innovative researchers working in a wide range of disciplines to pave the way for the prevention, recovery, and cure of mental illness.
In today's Speaking of Science podcast, Dr. Peter Behrman is a professor of sociology at the College of Arts and Sciences at Columbia University. He also serves as co-director of the Robert Wood Johnson Foundation Health and Society Scholars Program at Columbia. Recently, Dr. Behrman came to the National Institute of Mental Health to talk about the focus of his work, autism prevalence. NIMH Director Dr. Thomas Ensel sat down with Dr. Behrman to discuss autism research and began by referencing recent studies that indicate an increase in autism prevalence.
So as you looked at this, the question that everybody's asking is when they see the numbers now from the CDC, where it's gone from 1 in 1,500 to 1 in 150, and apparently here in the fall of 2009, the figure that's emerging is closer to 1 in 100, meaning that even since 2002, there's a very profound increase in the number of children being diagnosed with autism.
With autism spectrum disorders.
Autism spectrum disorders.
Yeah. Well, that's an important distinction. I mean, obviously there's a profound increase in autism and also in autism spectrum disorders.
Is there an increase in the number of children with the disorder or with autism spectrum disorder, or is this largely reflect the change in the way the diagnosis is used, or some sort of increase in ascertainment?
Well, I think that's the big, that's the million-dollar question. Our work, I think, which arises from California, can show that changes in diagnostic processes, in diagnostic criteria over, let's say, the period from 1992 to 2005, that changes in diagnostic criteria over that period that operate on the border between autism and mental retardation can be associated with about a quarter of the increased prevalence. Over that same period, there's been a really fundamental change in ascertainment. You can see that in lots of ways, but the most obvious way to see the changes in ascertainment is to see that the socioeconomic status gradient that used to be present for autism, the fact that the children living and residing in wealthy communities were more likely to get a diagnosis, that gradient largely disappears.
What seems important, Peter, in the way you've done this is that you're, rather than answering the question to say it's increased, not increased, you're answering the question by what proportion of the increase can be explained by separate factors, because everybody's pointing to changes in diagnosis, changes in ascertainment, the way in which services may affect the use of the diagnosis. Yeah. So what everybody really wants to know at the end of all this is that actually that more children are affected with the disorder, or will 100% of this increase in prevalence be explained by these other factors?
Our strategy is to try to decompose this increase into its constituent elements. Some component of that is increased ascertainment, some component of that is change in diagnostic criteria. Some component of that arises from already known risk factors. Increases in parental age are associated with greater probability of de novo mutations that could lead to copy errors that are associated with neurodevelopmental disorders. So social demographic changes that are affecting all Western countries, the United States and also California, can express themselves in increased incidence of autism on top of diagnostic ascertainment dynamics. And I think the trick is to decompose. The trick to figuring out how to decompose this increase into its constituent elements is to pay attention to two dimensions that are important. The first dimension is temporal, just the fact of temporal change. We're in the period of increased prevalence, and if we're in a period of increased prevalence, and at the same time, for example, there's also increasing older parents, the risk associated with older parents will naturally appear to be greater than it was a decade ago. So paying attention to temporal heterogeneity is important. The other part of our work, I think that's the most exciting, is to pay attention to spatial heterogeneity and the fact that we can observe very strong, very distinct, very stable clusters of increased risk for autism at very fine spatial resolution. For example, in California, there's a very clear cluster of about 20 kilometers by 50 kilometers in which the relative risk for autism, not autism spectrum disorders, but autism itself, is significantly higher over every year of observation that we make than any other place in California. And that invites a couple of considerations. First, it invites the recognition that if you observe local spatial clustering, whatever causes some component of the increased prevalence of autism is not a global treatment. Secondly, it invites us to ask, well, is there something in that local area that's driving increased prevalence? That could be a shared toxicological environment. It could be a virus that moves through and spreads person to person and affects children in utero, or it could be a piece of an ascertainment process, which would be the diffusion of information from parent to parent as they learn how to recognize symptoms for autism which have no biological markers.
From what you know now, when you add all of those together, how much of the increase can you explain?
Well, that's a complicated question, but I think we can pretty uniquely associate about a quarter of the increase from the birth cohorts of 1992 to 2001, which is a lot, to diagnostic change on the border between diagnosis of mental retardation and autism. And I think we can associate about 16% of the increase on the other border between autism and other neurodevelopmental disorders on the spectrum, Asperger's, PPD, NOS, etc. And those are largely non-overlapping components of increase. So that's about 40%. And I think that the spatial clustering itself adds another few percent. We're close to, I would say, I'm confident that 40% of the increase, we think, I think I know what's caused that. That leaves a lot of increase left. 50% is a lot to look for still.
Any ideas about what's driving that other 50%?
Yeah. Well, some is genetic, and I think that the increased parental age accounts for 11% of the increase over this period. That's a lot, and the mechanism by which increased parental age is expressing itself is, I think, likely largely genetic. I think that the tricky part is going to be to recognize that it will be harder now to find that 50%. It would look like it should be some toxicological environment that's shared because of the spatial clustering, but because there's a very strong process of amplification of the understanding of autism that leads to increased diagnosis as parents learn how to recognize symptoms, a very, very small event that would transform the environment 5 years ago, 10 years ago, even you could imagine 40 years or 50 years ago when the moms of children with autism now are in utero as eggs, a very small event could cascade into a larger epidemic now.
So what do you tell parents who ask about this if you have friends who have autistic children and they say, what's going on here? Why this epidemic? What do you say in response?
Well, I think parents are they're struggling with just enormous it's just enormously difficult to have a child with autism. It's just an incredible. It's very hard, and I think parents are naturally searching for explanations, and I think that the message now is the search for a quick and dirty explanation might not be advancing science.
Thank you very much.
Yeah.
Good discussion.